You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with gum disease. My first guest is Dr. Alice Moran. Dr. Moran is a board-certified periodontist, and she has a practice in South Orange County. Dr. Moran, welcome to the program.
It's a pleasure to be here. Thank you for having me.
Now, first off, before we get into today's topic, you don't look like a dentist. Do you hear that
Yeah,
a lot?
I do. Not as much now as I used to years ago when there weren't as many women dentists.
Okay, now why did you want to become a dentist? I always ask people when they come on the show.
You know, when I was in high school, I was looking for a part-time job, and one of my girlfriends worked for the local dentist. And then unexpectedly, she had to move, and she asked me if I wanted to take her job. So I just sort of fell into it. I was only 14 years old, and I loved working for him.
You were a hygienist as well.
Yes, so I started out as a dental assistant, and at that time I knew I wanted to do something in dentistry. So I never met a female dentist before, so the options at that time would be either become a dental assistant or a dental hygienist.
Was it rare, by the way, when you were in dental school? Not a lot of women in dentistry?
Not a lot of women at all. 52 dental students in my class, and we only had 5 women.
Probably had to make you a little tough back then to deal with all those people. You were also in the Navy. You were a commander for over 20 years. Tell me about that.
Yeah, I enjoyed that.
You were a dentist, treating...
Yes, I was a general dentist for 10 years, went to 3 different duty stations, decided I want to get involved in periodontics. Actually, I knew all along that that's what I wanted to do.
Why periodontics?
It's the logical progression to me, having been a hygienist, because treating periodontal disease is what hygienists do. You do also the prevention. You're trying to prevent periodontal disease.
Okay, so gum disease, by the way, and periodontal disease are 2 different things, but the patients call it gum disease?
Patients call it gum disease, and it's kind of blurry where one starts and where gingivitis stops and periodontitis begins.
So loose teeth, bleeding gums, what else? What's another symptom?
Bad breath.
Okay.
The teeth get longer. Remember the expression, somebody getting longer in the tooth?
Do they really get longer in the tooth? Is it the appearance that it gets longer?
No, it's because when you start losing gum tissue, you start losing bone, the teeth are actually longer than they used to be.
They start coming down?
Yes.
Now our program airs nationwide, even in Canada. I interview a lot of periodontists. Very few are board certified. You're board certified. What does that mean?
Yes. It means that you have to go through additional hoops. Okay. You have to present cases to the board, although the board certification has changed over the years. It used to be when I took it, you would have to treat a number of patients, show photographs before and after, probings. We measure the gum tissue, so they would have to see our charting of the patients. And then after you presented your cases, then they were free to ask you any number of questions that related to your patient or didn't relate to your patient.
Okay.
So they're finding it's too difficult to get these cases because you have to follow up the patients for a year, and sometimes people move and things happen. Okay. So now it's become more practical.
On to today's topic, new treatment options for people with periodontal disease. What are the different categories of periodontal disease?
There's gingivitis, which is early periodontal disease. It's when the gums are bleeding because you haven't gotten all the bacteria off the teeth. So 100% of patients, if they don't brush and floss their teeth, are going to get gingivitis. Takes about a week.
So if you don't, okay, what about people that only bleed when they floss? Are there certain people that even bleed when they brush?
Sure, there are people who bleed during brushing and flossing and both. But any blood at all is a symptom of disease.
And that can be turned around. I mean, that's an easy one to fix?
And that can be turned around. Yeah, when you have gingivitis, that can be fixed by good home care, or professional cleaning with your dentist or hygienist. And the catch is to not let that get to the point where you start losing gum tissue and bone. And that's when you start talking about periodontitis.
So periodontitis is what then? What are those symptoms?
What defines that is that you've started to lose bone. In terms of the symptoms, they're going to be really the same as with gingivitis.
So the teeth get loose.
But the teeth getting loose, that means that you have periodontitis.
But why are you losing bone?
Gingivitis.
Help me understand that. Why the loss of bone?
What happens
so the bacteria is getting in there? What's going on?
It happens on 2 fronts. First, the bacteria produce enzymes that destroy the bone. Then your body is trying to protect you, and it produces different enzymes, and those enzymes destroy the bone. So you're kind of getting it on both ends.
And that's why the teeth get loose.
Right, because they don't have as much bone. If you think of like a tree in the ground, you know, the roots in the ground, if you were to unearth the dirt around the tree, that's what happens.
So this bacteria,
yes,
it rests where? Underneath the gum line?
Yes. It can be on the teeth as well, but the bacteria under the gum line.
Now what about severe periodontitis? What is that?
That is when you start noticing increased mobility. At that point, they may start having pain. Typically with early periodontal disease, there's not a lot of pain involved. But as it gets more severe, frequently patients will have pain, but not always, which is a thing to be cautious about, because a lot of times when patients come see me, they say, well, I don't see how anything could be wrong, nothing hurts. And I say, well, you know, it's a lot like arthritis or some chronic diseases, or not really arthritis, because arthritis you can have pain, but say diabetes, certain types of heart disease, high blood pressure.
Right.
A lot of times you feel great and you have problems.
Now we talked on the telephone, you say that a lot of periodontists don't even like, in general, dentists don't like treating periodontal disease. It's not very sexy. What do you mean by that?
Exactly. Well, certain things that we treat in periodontal therapy, you get immediate gratification. Like when we do a soft tissue graft, somebody has recession and you add gum tissue, you can see a result right away. Cosmetic crown lengthening, implants. Some of these treatments, they're the more sexy treatments because the patient sees something right away. Mm-hmm. Unfortunately, with the garden variety periodontal disease that we treat, you don't see the results right away, oftentimes. And so periodontists, frankly, a lot of periodontists have gotten disillusioned about treating gum disease because traditionally we treat it with surgical treatment. Mm-hmm. Patients don't like to get surgery. A lot of patients delay getting surgery or never get periodontal surgery.
You say they won't accept the treatment plan?
Very often they will not accept the treatment plan.
Are there gums cut in that procedure?
Yes.
Okay.
With traditional periodontal osseous surgery, what we do is we go ahead and we make an incision, we pull the gum tissue away from the bone, and we clean everything out, and then we suture everything back together again.